Hey everyone! So, you've got a big clinical exam coming up, right? Well, you're in the right place. Today, we are diving deep into bowel elimination. This is going to be a super focused, high yield review to make sure you have exactly what you need to walk into that test feeling totally prepared. So, here's our game plan for today. First, we'll lock down the basics. What's normal? Then, we'll look at what can go wrong and why. After that, we'll cover what we can do about it, touch on some key medical interventions, and wrap it all up with ostomies and specimen collection. It's a clear roadmap, so let's get started. All right, let's jump right into section 1. And this is so important. You can't spot what's wrong if you don't know what's right. Establishing that normal baseline, that's the absolute foundation for every assessment you're going to do. So at its very core, bowel elimination, or defecation, is just the body's way of getting rid of solid waste. It's a super fundamental process, and trust me, in your clinical practice, you'll see that when this system isn't working right, it can affect a patient's entire well-being. Okay, look at this slide. Seriously, this is your clinical cheat sheet. For your exams, you're gonna wanna know this stuff inside and out. The gold standard is brown, soft, and formed. But what if you see black, tarry stool? That should make you think of bleeding. Clay-colored? Maybe a liver or gallbladder problem. And remember, normal frequency is different for everyone. The key is to notice a change from their usual pattern. Perfect. Now that we've got a handle on normal, let's move into our next section. We're going to explore all the things that can mess with the system and the common problems you will absolutely see in practice. Think of these as the main control knobs for bowel function. Diet is a huge one. Fiber gives stool bulk, and fluids keep it moving smoothly. Getting up and moving around stimulates the intestines, and you can't underestimate privacy and routine. Changing that up can cause real issues. But pay close attention to medications. Pain relievers are a notorious cause of constipation. This lays it out perfectly. The two biggest issues you'll face. On one side, you have constipation. Think hard, dry, and difficult to pass. On the other side, diarrhea, loose, watery, and frequent. And the big risk with diarrhea? Dehydration. You've got to watch for that. They're total opposites, and both need careful attention. Okay, pay close attention to this one, because it's a classic trick question on exams. That last sentence is everything. A fecal impaction is a serious blockage, but the patient might actually look like they have diarrhea because liquid stool is managing to seep around that hard mass. Recognizing that seepage is a huge diagnostic clue. Just a couple of other quick terms to have in your back pocket. Fecal incontinence, which is pretty straightforward, the inability to control bowel movements, and flatulence, which is just the medical term for excessive gas. Simple definitions, but you'll need to know them. All right, time to shift gears. We know the problems. Now, what are we going to do about it? This next section is all about the practical, hands-on stuff you'll do to make your patient more comfortable, keep them safe, and help get things back to normal. Listen, these points right here, they're practically guaranteed to be on your test because they are all about patient dignity and safety. Privacy is non-negotiable. Answer those call bells fast. And remember, the natural position for elimination is squatting, so a toilet or commode is always better than a bedpan. And of course, good care afterward prevents skin breakdown. Simple things that make a huge difference. So bowel training. This is how we get proactive and help a client get back on a regular schedule. And notice anything? These steps are the direct solution to the problems we just talked about. We're using diet, activity, and routine to fix things. The idea is to time it with the body's natural reflex, that signal your stomach sends to your colon after you eat to make some room. Okay, now we're getting into the stuff that needs a doctor's order. These are the more direct, hands-on interventions we use when those lifestyle changes just aren't cutting it. So let's just stop and think for a second. When we turn to these tools, what are we really trying to do? What's the main goal here? Well, here's your answer. It all comes down to one thing: stimulating a bowel movement. We might do this to relieve some really uncomfortable constipation or a dangerous impaction. Or sometimes we need to completely clean out the bowel before a big procedure like a colonoscopy. All right, this slide is mission critical for safety. And for your skills exam, you have to know these steps by heart. You position the client in the left side lying, Sims position. That's lying on their left side with that right knee bent up. It just follows the natural plumbing of the colon. The solution should be lukewarm. Too cold is uncomfortable, too hot is dangerous. Go slow. And most importantly, listen to your patient. If they say it hurts, you stop. Period. All right, we're in the home stretch now. For our last section, we're going to hit two really important, distinct topics that you'll definitely see on your exams: ostomy care and how to properly collect a stool specimen. This is a number you just have to burn into your brain. 1/3 to 1/2 full. That's when you empty an ostomy pouch. And here's why that's so important. If that thing gets too heavy, it can literally pull the whole pouch right off the skin. That causes leaks, skin irritation. It's a mess. It's a simple rule that prevents a huge problem. Here are your other vital signs for ostomy care. A healthy stoma, the part you see, should look beefy red or pink, and it should be moist. That tells you it has good blood flow. Anything else, if it's pale or gray or black, that is a drop everything and report it now emergency. And of course, protecting that skin around the stoma is key. And last but not least, stool samples. Yeah, it's not the most glamorous part of the job, but knowing how to collect a sample correctly is a vital diagnostic skill. Those samples go to the lab to check for things like hidden blood or infections, and they give doctors the clues they need to make a diagnosis. Look, before we wrap up, I really want this to sink in. This explainer is great for getting the knowledge in your head, but there's no substitute for hands-on practice with an instructor watching over you. Safety, competence, and respect, those are skills you build by doing. So as we finish up, I'm going to leave you with this one thought to carry with you into your practice. You can know all the steps and all the facts, but the real art of being a great caregiver is answering this question. Think on that as you study. Thanks for tuning in, and good luck on those exams. You've got this.